I read recently that at best the proposed levy is being framed as a possible 1% increase on property taxes over a period of 10 years, a supposed cost of $30 annually per household. At face value, this request could seem quite innocuous and perhaps even reasonable. However, deeper thought and inquiry reveal a number of troubling unanswered questions. My partner and I recently moved back here after several years in Toronto, have many of the same concerns here that have been voiced tonight, that is to say, the lack of meaningful, open, and truly reciprocal dialogue regarding a plan that will irrevocably alter the various communities in which our city and region is comprised, the squandering of our resources, namely the destruction of viable farmland, which, as we know, is becoming increasingly scarce in the 21st century, coupled with the unnecessary burden of having to provide and pay for infrastructure to service this land when Windsor is currently riddled with large vacant brownfield sites. Three, also the very narrow vision of raising our local hospitals to the ground rather than creatively integrating and utilizing existing services and structures already financed by our tax dollars and by the generosity of community donors. So while we have these concerns, my most urgent personal concern is the social justice aspect of this proposed system plan, for which this levy is to be a key instrument. We know, for instance, that 44,000 people in our city currently live in poverty. We know that our wait list to access social housing is 3,000 people long. We know that homelessness in Windsor is on the rise, and we know also that our local food banks struggle to keep up with the demand for their services. The acute care component of the proposed system plan, for which support is being sought tonight via this levy, places our most economically vulnerable neighborhoods and people that live in them the furthest away. We have been told that in recompense, the system plan will see enhanced mental health services and an urgent care clinic open 14 to 18 hours for residents in these vulnerable areas of the city. And money, by the way, is currently being spent advertising before discussion and approval of funding has even occurred. But I ask you here tonight, what kind of message does such a configuration send? The proposed plan, as it stands in my mind as someone who lives in these neighborhoods and sees how people struggle on a day-to-day basis just to have the basics, food and shelter, and as someone with a professional background in equity studies, this plan, in my mind, serves to ghettoize the poor and further reinforces stereotypes about them. I have often heard, well, that's what those people need down there. That's the kinds of services those people require. Pathway to Potential has just received a government impact grant to tackle poverty in meaningful ways that goes beyond charity handouts and feel-good photo ops. This prestigious impact grant will work to address poverty at structural levels, that is to say, creating the conditions for a more equitable society. We have even, this grant is going toward hiring not just one of, a top advisor in Canada, but one of the top advisors in North America. The proposed plan runs counter to these goals. This levy asks us to begin paying now in support of a plan that will demolish 2 local hospitals. And as others have mentioned here tonight, these hospitals have seen millions of dollars poured into them, making them quote-unquote state-of-the-art. This plan asks us to pay now for this levy asks us to pay now for a plan whose total cost is unknown. Infrastructure costs are not factored into this levy. We have no idea about the specific costs and details of plans for extending public transit, for example, to the facility. We are being asked to pay now to support a plan that contributes to sprawl, environmental degradation, and further destruction of local resources. We are being asked to pay now for a plan that further exacerbates the widening gap between poverty and wealth.
Thank you, Lisa.